Hello, and thank you for joining us for our session on Breaking the Stigma, Prostate Cancer in the Black Community. My name is Jeremy Patch, and I'm the Senior Director, Patient Programs and Education here at ZERO Prostate Cancer. We're excited you're here to hear from our esteemed featured speakers, Dr. Leanne Woods-Burnham and Dwight Eubanks, joining us shortly. Now, please join me in welcoming, again, Dr. Leanne Woods-Burnham and Dwight Eubanks. Dr. Woods-Burnham is an assistant professor in the Department of Surgery at Morehouse School of Medicine in Atlanta, Georgia. Her team focuses on prostate cancer health disparities. She is also a part of ZERO's Medical Advisory Board, and we're glad to have her. Dwight Eubanks is a trailblazing entrepreneur and TV personality with over 30 years of experience in all things entertainment and fashion. We are excited that he is here sharing his story with us today. Thank you so much to both of you for joining us. It's my pleasure to hand it over to you for this important conversation.
Thank you so much, Jeremy, and welcome, Dwight. We're so honored to have you today, this week in particular, and we thank ZERO for all of their support, particularly for putting on this summit, which is just a great resource for current patients and their caregivers and families. And as Jeremy mentioned, I am an expert in prostate cancer as it affects Black men specifically. And I look at that locally. I'm here in Georgia, also on a national level, and also some international work. And so I'm very familiar with some of the reasons why prostate cancer is worse in the Black community. But I never thought, being a fan of Mr. Dwight Eubanks, Mr. Fashionista himself and hairstylist for the gods and all of this over the years, I never thought we would be having this conversation, or even that I would get a chance to meet you as I did a few months ago. But you're doing some really exciting and important work, bringing awareness to this yourself. So would you mind explaining some of the work that you've been doing in the past and sort of how we met originally?
Well, we met. First of all, thank you all so much for having me for such an important opportunity. I started this journey, I suppose I started it when my grandfather passed many years ago. Just the awareness about prostate and the importance of it because he died from prostate cancer many years ago. And fast forward, I have several friends that has gone through it that I grew up with, and we made a pact that we would always be there for each other if anything should happen. And so I kept my bond. Everybody's kept their bond. So last year we started a campaign of what we call Shop Talk and Knowing Your Health, and that's how I was introduced to Morehouse School of Medicine and the amazing team that's worked with prostate cancer. So for the whole year, we went on a journey of just educating the public about knowing about your health. And of course, prostate cancer came up in one of the episodes. And here we are.
Here we are. Yes, and you were doing a wonderful health fair promoting prostate cancer awareness and education and screening in downtown Atlanta. I think it was September, the month that we're really focused on prostate health. And as I've gotten to know you, and your relationship with ZERO has formed, and you're now, congratulations, a brand ambassador for ZERO and helping promote and awareness and education. Um, how has this sort of hit home for you more recently, if you don't mind sharing?
Well, well, again, I was being Dwight, being silly. We had an event January this year and at church, and I was just being silly. Always promoting and talking about other people, and something told me just go get tested because the person that was doing the testing was vacant. They weren't doing anything. So I said, okay, let me give you guys something to do. Went over, got tested, and 5 days later, I get a phone call saying the doctor wanted to see me. I was like, well, what do you want to see me about? We could just talk about this over the telephone. Why do I need to come into the office? So I said, okay, fine. Went in and he dropped the bag on me that I had a high PSA. At that time, it was 8.12. And I was just devastated. So we had a conversation, and he said, well, I had another doctor friend that said, let's just don't get absorbed with the numbers. Let's just watch it for a couple of months, see what happens, see if it goes up, see if it goes down, because it could affect the prostate testing could affect on several things, like what if I had had an orgasm the day before, or so many hours prior to being tested. That would also affect the numbers. So I said, okay, fine. We waited and went back in April, and it had gone from 8 to 10. So I said, okay, this is changing. So we ordered the PSA, came back, and not the PSA, but the biopsy. The biopsy, we recently got the biopsy, and so we know exactly where it is. As he explained it to me, it's like an egg, and inside of the yolk is where the target is, and it's relatively large, but it's not outside of the yolk, which he said was which was good. So here we are, and just there are no coincidences. Everything happened for a reason, and I said this has been preparing me for this point from my grandfather. And I was always told that, being that it was on my mother's side, my grandfather, that my chances of having prostate cancer was slim to none. So I went with that. I go to the doctor all the time, from the 80s, the early 80s, from the AIDS epidemic, and always wanted to know, about my health. So that was my first introduction to going to doctors, and I've been going. And fast forward, out of the three doctors that I've had since the 80s, all of them have died. And went to a new doctor recently, once I discovered all of this, and my records has just disappeared. Being
Mhm.
that the office closed and they did not transfer my records to the new doctor. So all of my medical history for the last 30 plus years has disappeared. So we go on and find that LabQuest was the lab that was doing my blood work. So he was able to go to LabQuest, pull in my information, and it came up.
Mhm.
Came back into the room and gave me a sheet of paper. And the first thing that I saw on the paper was high PSA.
Mhm.
And I was like, this cannot be true.
Mhm.
But that was in 2022. Not a word. Nobody said anything about you need to check it, watch it, or anything. I guess they were looking at other things and not the PSA for my prostate. So we can go back now to 2022 to know that this is when it started.
Mhm.
So here we are.
You are so courageous, for sharing your story. That's so common. We know the average man in the US, 1 in every 8 will get prostate cancer, but for Black men, that's 1 in 6. So there's just a much higher likelihood. So thank you for being transparent and sharing. You remind me, as you tell me your story, of my dad, who's the Black man who was diagnosed when he was 50. Um, by the time he was diagnosed, his PSA was 64. He found out an accident in the emergency room at that time. But he was like you. He's healthy, he's vibrant, he eats well, he watches his figure, all of these things, right? But he was having this unharbored, undetected prostate cancer that we didn't know about. And so when we look back over his medical records, we saw, well, 7 years before that, he had an enlarged prostate. 7 years before that, his PSA was starting to rise. But um, if you hear your doctor say at the end of your appointment, your numbers look good and you're okay, and I'll see you next year, you're not going to really press the issue. And so one of the things that we do at Morehouse School of Medicine and in the greater scientific community in looking at prostate cancer in Black men is we're really passionate about making sure that men, first of all, are being screened in the clinic, because you're blessed that your doctor even ran a PSA test. A lot of Black men go in the clinic, and we know from research studies, this is data driven, that 54.8% of Black men that go into the clinic, their doctors don't even have the conversation with them about getting screened for prostate cancer. So that's the first issue. But then when you are screened, you really want to advocate for yourself and be comfortable, know that you have a physician that recognizes the higher risk in Black men and know how to treat your situation a little bit differently than they may for another person. And so there's lots of great primary care physicians and urologists who are passionate about this issue and make sure that their patients get excellent care. But unfortunately, as in every profession, it's not always standardized. And so we're really working on, at the bench, at the clinic level, also involved with policy, because a lot of these issues happen much higher up when we're talking about screening recommendations and things like that. But what do you feel as a Black man? It sounds like maybe your family didn't talk about prostate cancer thoroughly, but maybe some people did. It's interesting that you said that you thought it was more linked to the, dad side versus mom side, that sort of a thing. On a side note, I'll just throw out, we do know that when we're talking about women, there is a link between breast cancer in women and prostate cancer in men. And I know you weren't talking about breast cancer in particular, but cancers in general that have hormonal origin and hormonal factors that drive the cancer, there is something to think about when you're thinking of the women in your family and the men on your family. So I just think that's interesting that you pointed that out. But what do you feel are some of those barriers maybe to men in the Black community talking about their health with family?
Well, I think it's because the stigma that society have shown us that we are not relevant, and um, we just weren't important enough to have those conversations. But and for my family, when granddad died, it was just that he died from cancer. He moved to Australia, and that was it. There was no more conversation about it. And so I did the research and came up with what I came up with. But again, we don't talk about it for several reasons. And I must say I came out about it because I was going into the same stage that he was. I didn't want to talk about it. I just told my family about it. This has been going on since January.
Mhm.
I just told my family about this Labor Day weekend.
Mhm.
And because in my mind, I wanted to deal with it by myself. I didn't want other people to be bothered or burdened or worried about me. As a Black man, and regardless of what your preference, sexual preference is, you're still a man. And you still have that mentality that we are in control and we can handle everything. There's nothing that I can't handle. And I'm that person in my family that I get it all. So I'm the fixer. I'm
Mhm.
the fixer in the fashion and beauty industry, the design industry, hair, and everything that I do that well, I have a solution for it. So I avoided it, and I just thought I could handle it and just go through it by myself. And I
Mhm.
understand I have people around me that love me, but again, in my mind, in my head,
Mhm.
that I can do this by myself and I can maneuver through it and be okay.
Yeah.
And that's not the case. We have to have those conversations. And like you said, your father found out about it. My doctors found out about it, but they didn't have a conversation with me about it. So it's like, what's the point?
Yes.
But again, the doctors failed me. But again, my doctors were old. The doctors now are different. Now, when I go in, they give me paperwork or they tell me how to go on the site to find out the work and research it and look at it for myself. And
Mhm.
that's what we have to do and understand that doctors are human. They
Mhm.
do make mistakes. You have good ones and you have bad ones.
Mhm.
But it's up to the individual to be over their control of their destiny, of their health. And
Yeah.
that's why this is so, so very important because people are afraid. You hear the word cancer, you panic, think this is the end of the world. It's not. I had a conversation with my team, and God has assured me that I got another 60 years to go.
We're
So I'm
claiming
going to
it.
embrace that and
Yes.
claim it. And so it is. So it's not a death sentence. We don't need to be afraid of it. And don't worry about, and straight man, a man, period, worried about the anal,
Mhm.
of somebody looking into their
Mhm.
butthole.
Mhm.
The doctors are not really concerned about that. They're beyond that. So we just have to get this over this macho mentality that nobody's going to check my prostate. Nobody's going to check my, touch it. So
Mhm.
it's like we have to open up those conversations.
Well, that, and when you think about it, the PSA blood test, which is the one
Yeah,
I'm assuming got when
I-
you went, to the church screening,
absolutely.
that's just a blood test, even for men who are really just adamant, like, I can't wrap my mind around that.
Right.
Okay, it's a blood test, but we can start with that, right? And that's what U.S. Preventive Services Task Force recommends starting with, is the blood test. I have a question for you too, because you look amazing per usual. And did you feel okay? Did you have signs? My dad had zero sign symptoms with the PSA of 64. And a lot of people think, I feel fine. I'm about to turn on the NBA finals. I don't know, need to go get my prostate checked. So how do you feel?
I feel amazing. The only thing that I should probably have paid more attention to is urinating a lot, but I triggered that too. I drink a lot of water. I mean, I drink water all day. That's all I really drink. I don't drink sodas. I don't drink coffee, any of those things. So I guess contributed to that. And then I started to wake up more at night and having to urinate like 2 or 3 times, and then it got progressively worse. But I thought, okay, I'm just drinking a lot of water, and then I stopped drinking water at anything after 9 o'clock, and it kind of slowed it down. So I contributed to the water, but for as feeling bad, I feel fine. I'm still working. I worked today. I worked yesterday. So I still have a full schedule. And the other thing is I'm 64. So I'm supposed to be a little tired, and I
Lies,
supposed
lies,
to.
lies, Dwight, lies.
Yeah, I'm pushing 65 next year. I guess I thought maybe it's because I got a little tired, a little more tired now. But at 65, I suppose I should be tired. And from thinking in my mind that I'm still 25 and I can go to 5 parties in one night and hang out all night, but those days are over with. Now I have to take a nap. But other than that, I'm good. I'm good.
Yes. Yeah, so those are the things for men to realize. And sometimes some of the symptoms we sweep them under the rug because it is gradual, and you just feel like you're getting older, and that's what's happening. Do you feel that you and I are in Atlanta, and Zero's initiative called Blitz the Barriers, which is so amazing, this initiative they just launched, where they're going to be focusing on improving health equitable outcomes for Black men with prostate cancer. And they're starting with the focus in Atlanta and Baltimore. You and I are in Atlanta. I can feel the tide shifting here in terms of bringing awareness and screening. And your event that you had as an example, Morehouse School of Medicine, we have a group called Prostate Cancer Precision Prevention Program, or PCP3, and we're providing PSA testing at no cost to men in metropolitan Atlanta and also throughout the rest of Georgia. Do you feel over the past few years, do you sense a difference or more awareness in our region?
Absolutely, absolutely. And from the very first event that we did leading up to now, it has been just amazing, the amount of people. And it's interesting to me is the fact that, um, did I freeze?
It's going a little slow, but I can
Okay,
still.
so I lost the screens,
Oh, we lost you on the camera.
um, but we don't need to see me. Uh, um, but it's interesting to me to see the amount of heterosexual, allegedly heterosexual men, um, come to me and to have the conversation about
Mhm.
their prostates. So it's shifting, and I guess they're getting to be a little bit more comfortable with it. So it is changing.
Yeah, it is changing. I'm going to see while we figure out what's going on with your camera. I want to make sure that we leave room for some questions. I see in the chat box, we're really encouraging people, if they have questions, rather than raising your hand, if you can text them at the bottom of the screen. Jeremy, let me know if there's something that Dwight and I aren't seeing. We'll be happy to answer questions, but I wanted to mention that if people want to put questions in the chat box, that's fine. Um, Let's see, what else could I ask you?
Yeah, Leanne,
Yeah, you
it's
have a,
the
see one?
bottom of the Q&A. It's the Q&A box specifically.
Oh,
that
let me
you're
go there. Let me
looking.
go there. Okay.
There is one for you. It would be more for you. Are you
Mhm.
familiar with any active surveillance programs that target the African American community, especially given higher incidence of mortality we experience? And we just finished a doctor talking about active surveillance, so this is kind of related to that, particular to
Sure.
African American men.
Yeah, so there's a few, right? Now, I guess it would depend on what part of the country you live in, but I would recommend, um, and this is an interesting topic for Black men in general with prostate cancer. I really highly advocate for participation in clinical trials. Clinical trials are not always drugs. Clinical trials are not always associated with pharmaceutical companies. Clinical trials can be behavioral, public health clinical trials. I just encourage clinical trial participation from all populations because we don't move the needle forward for all populations unless all populations participate. So as a scientist, I'm very adamant about making sure that when I'm designing a trial, a scientific trial, that I'm thinking of my dad in my head. I'm thinking of people like Dwight in my head. I'm thinking, how will this benefit a Black man with prostate cancer in particular and give them VIP access to what's the best out there? Because if you are at the highest risk of a disease, you deserve the best access to the best care. That's just how I see it. So I don't know if that's controversial. That's just what I think. But back to the question, in terms of active surveillance, there are active surveillance clinical trials. If you go on clinicaltrial.gov, that shows you any and all clinical trials that are occurring in prostate cancer. You can type in prostate cancer, you can type in active surveillance, you can type in African American or Black, all of these search words. Then you can type in what state you live in. Some participation, sometimes you don't even have to go in person. Some participation you get compensated, others you don't. The clinical trial world is humongous, right? So it'd be hard to really pinpoint an exact trial, but I would suggest that you start there if that's something that you're interested in participating in. I see another question here, Dwight. I don't know how
And we
comfortable you
and
are
and we do
responding.
have Dwight's video back. So
Yes, okay. Dwight, if you can answer it or not, but somebody is asking, how have you treated your prostate cancer? Are you removing it? Are you doing proton therapy or, what are your thoughts?
I am adamant at this point, and again, like I said earlier, I have a great team of doctors. I have like 5 doctors that I'm dependent on to navigate me through this whole process. And from what I have gone through with others, to remove it is like not even a conversation right now. There's so many other new technology and information and ways to handle it. And so I want to explore everything. But the first thing that I did in the beginning in January, I changed my diet and took out sugar, less alcohol. I cut it down, not out. And just eating healthier, eating snacks. You know, those are the snacks that more healthy stuff. So we're just gonna wait and see what's gonna be the best route to help continue to have a healthy life.
Thank you, Dwight. We have another question. Somebody's asking, they said, can I have a PSA test for free or do I have to pay for it in Atlanta? So we do have, as I mentioned, Morehouse School of Medicine's PCP3 program. If you do want to receive that test at no cost, we have several events. It's a constantly rotating schedule, but if you're available on Saturday, June 21st, we'll be at Israel Baptist Church, which is on Hosea L. Williams Drive in Atlanta. And we'll be there from 10 a.m. to 2 p.m. offering PSA testing at no cost. So you definitely come there if you're available. I also believe that ZERO on their website has links that are available to different options, either at no cost or low cost screening. So I would check them out and see if they have something available near where you live at. And then,
Let me add.
yeah.
Let me add to this. Also, with that was free, but it was interesting when I went to get the MRI done. My insurance didn't pay for that. There was another $350 that I had to pay for. But since then, I've found out there are other programs that will come in if you don't have the money to pay for it that would have paid for it. So you just have to do the research and don't let obstacles get in the way of your knowing your health and taking control of your health. You know, it's many things that will come say, well, I don't have it right now, or I'll wait. But no, move forward, press forwards, and because there are organizations out there for support.
And it's excellent that you're mentioning that, because ZERO has been very active in pushing policy to take away cost and financial barriers for people who are seeking to get screening. And that trickles downstream after that as well. And so there is an act called PSA for Him Act that a lot of us have advocated for on Capitol Hill to take away sort of insurance costs that are trickle down to the patient when they go to get screened. As a woman, Dwight, I don't know if you know, but if I need to go to get my annual mammogram, I don't have a copay for that. Women, we don't worry about that. But it's not that way for men who are getting tested to see if they have prostate cancer. And so we're trying to level the playing field currently. And that's not a partisan issue, right? Everybody has, all men on the Hill, they need to get their prostate checked. It doesn't matter which side you're on. So it's just an important issue.
Oh, absolutely.
And to add to that, we just dropped in the chat how you can get involved as an advocate and in other ways as a volunteer here. But one of the ways is as an advocate, and things like advocating at the state and federal level for the PSA for Him Act, right? So just wanted to point that out.
Thank you so much, Jeremy. Yes.
Well, we're at, as much as I would love to continue this conversation and really hear you all speak and discuss this important issue, we are at time, and so we appreciate your time and our attendees' time. So thank you so much. Dwight, we're honored that you chose this platform to tell your story, and with sharing it with Dr. Woods-Burnham here, and we know you thankfully have been connected for a while. But we're at ZERO, we're honored that to make that connection with you and help elevate your story, because it is so important. So thank you so much.